Evaluation of pneumonia from transition to translation. Please read those answers. عندنا حاجات كتيرة قوي في الوصف دي فحبينا ان احنا نقول لكم في برزنتيشن عنها. السلام عليكم. اولا يعني طبعا جزيل الشكر للفرصه الكبيره اللي اتيحت لنا النهارده كاطباء رعايه اطفال مستشفى مشيط البكر. احنا جوه تواجدين مع حضراتكم النهارده في اول مؤتمر لينا. الف شكر للحضور الرائع الجميل من اساتذتنا وزملائنا والمشاركه الايجابيه الرائعه من اساتذتنا الكرام. نورتونا ويا رب ان شاء الله يكون مؤتمر يعني ناجح ومثمر وعلى قدر المسؤوليه باذن الله. From consolidation to capitation, we are going to talk about pneumonia pneumonia clinical cases from our PRC. First, as a rapid introduction, what is necrotizing pneumonia? Necrotizing pneumonia is a rare complication of community-acquired pneumonia and is characterized by catastrophic illness and a prolonged hospital stay and the disease course. It is characterized by the development of necrosis, liquefaction, cavitation on the lung parenchyma by an infectious pathogenic agent in the child with community-acquired pneumonia. Necrotizing pneumonia may progress rapidly in previously healthy children despite early and adequate treatment of the initial community-acquired pneumonia. Although necrotizing pneumonia is still deemed to be rare, but the incidence of pediatric necrotizing pneumonia has increased. Primary history, necrotizing pneumonia was first described in adults in 1940s, and around 1994 the instance was reported in the children, with a gradual increase in the reported cases stemming partly due to increased awareness and improved diagnostic techniques. What are the positive pathogens? The most common pathogens reported in the children with necrotizing pneumonia are Streptococcus pneumoniae, approximately 60%, especially serotype 3 and serogroup 19, Staphylococcus aureus more than 20%, Mycoplasma pneumonia, Klebsiella pneumonia, Pseudomonas, viral causes as an adenovirus, influenza, parainfluenza, fungal infection, or co-infection. According to epidemiology, last year reported that 3% of cases of community-acquired pneumonia in UK have complications, but nearly more than 4% of community-acquired pneumonia are necrotizing. Children aged less than 5 years have the highest incidence of community-acquired pneumonia complication, and the retrospective study shows the incidence increasing during the past 20 years. In our PICU in مشيط البكر Hospital, وده شغلنا احنا بقى. In the last year, we have recorded 25 cases of necrotizing pneumonia. According to demographic data, 21 cases were less than 6 years, 4 cases were more than 6 years, 14 cases were males, 11 cases were females, 19 cases were less than 20 kilograms, and 6 cases were 20 kilograms. Clinical presentations اللي كانوا جايين بيها 21 cases were presented with prolonged fever, cough, tachypnea, 4 cases were presented with fever, abdominal pain, and persistent vomiting. Our investigation tools اللي احنا بنعملها laboratory, complete blood counts, inflammatory markers, and CRP, ESR, LDH protein, D-dimer, and sometimes cardiac enzymes. Cardiologically, عملنا X-ray, CT chest, and chest ultrasound. Radiological finding اللي كانت موجودة كانت in the form of lung consolidation, pleural effusion, empyema, pneumothorax. The right lung was affected mainly in 9 cases, left lung كانت affected mainly in 10 cases, and bilateral affection in 6 cases. According to types of ventilation اللي العيانين دول احتاجوها, 8 cases needed conventional mechanical vents, 11 cases needed high flow nasal cannula, and 6 cases needed mask, oxygen, and cannula. according surgical interventions and mortality. 19 cases needs no surgical interventions, 3 cases need surgical interventions, and the mortality was 3 days. دي اكس-راي، بعض الاكس-رايز من العيانين بتوعنا احنا في البي اي سي يو اون برزنتيشن. ده عيان جاي من بيته، جاي بهذا القدر من السيفيريتي. This is community acquired not hospital acquired pneumonia, complete affection bilateral more على الرايت سايد بنيوموثوركس لونج كولابس، left lung ايفي تقريبا مش موجوده، severe affection على الليفت لونج، نفس الكلام الليفت لونج severely affected في our patients. اللي في النص دي فيها تنشن pneumothorax with lung collapse، وزي ما قلنا ده on presentation left lung severely affected. مقاطع من ال CT to our patients shows necrotization with cavitation اللي موجود على ال right side of the lung, right side, poor effusion on the left lung, severe affection على right lung, again necrotization, cavitations على right lung. Now we are going to present 2 cases from our EICU cases. Case number 1, Muhammad, 3 years old, male patient, 4th order first of non-consumption experience with no significant past medical or surgical history. Presented complaining from fever, dyspnea, tachypnea, abdominal pain of 15 days duration. Sought medical advice, received the medical treatment in the form of antibiotic injection, Cipotex and Unacin for 7 days, but he didn't improve and was referred to our ER with respiratory distress grade 3. According to past history and family history, no recurrent hospital admissions, no history of asthma or recurrent wheezy chest. He was vaccinated with the obligatory vaccines up to date and normal development according to the age. By examination, generally the patient logged L, pain, toxic, in heart rate can 165, respiratory rate 60 per minute, capillary filling time 2 to 3 seconds, blood pressure 100/60, saturation can 88% on the room air, 94% on the nasal oxygen at 2 liters per minute. Chest can he markedly diminish their entry on the right side, course and fine cracks bilateral with subcostal and intercostal retractions, cardiovascular can normal heart sound with no audible murmur,